First of all, I want to thank everybody who is attending this webinar and our team, and to share with you that working with cancer patients is a big passion and mission of my life. And about 70% of my practice is dedicated to cancer patients. Next slide, please. So from the beginning of times, we knew only complementary and alternative medicine. For example, Ayurveda medicine or Chinese medicine are about 3,000 to 4,000 years old. And only in the last 200 years, we start having what is called now mainstream medicine or allopathic medicine. And here will be, of course, the surgeries and chemotherapy and radiation, immunotherapy, and other mainstream Western medicine. But there is a tendency, there is a tendency right now to combine Eastern and Western medicine to get a much better outcome in care for our patients. So today I'm going to briefly talk about how acupuncture works. This is the slide which shows the stone plates which have acupuncture points, and they're about 5,000 years old. They right now are in London Museum. So Chinese doctors believed in older days that we have 12 channels and meridians, and a special energy called qi is moving in our body. And usually if that energy is in disharmony, if it is blocked, stagnant, or deficient, we develop a disease. Cancer usually, from Chinese point of view, considered to be a stagnation or accumulation of blood, qi, and sometimes we call it phlegm. Next slide, please. But of course, from Western point of view, it doesn't make any sense. And doctors all over the world start doing very sophisticated studies. The most simple one was when they would check the blood of the patient after acupuncture treatment, they discovered that in the blood of that patient, there are a lot of different neurotransmitters, the ones like dopamine, serotonin, and many others. So they realized that acupuncture somehow is connected to human brain and allows human brain to release certain neurotransmitters. They went further and they noticed that when we put the needle in the human body, there is also on functional MRI a reaction. And for example, if we're using the point which is responsible for the eye vision, and the point is located on the toe of a patient, something happening with the brain, and you can see it on functional MRI, which is responding exactly to the eye vision part of the brain. Next slide, please. So what can we exactly do for patients who go through the treatment, like surgery, chemotherapy, radiation, and others? Let's start with chemotherapy. Chemotherapy very often will have a tremendous uncomfortable side effects. The ones like dropping of the blood count, nausea, vomiting, the ulceration in mucous membrane. And here, not only acupuncture, but also Chinese herbs will be very, very helpful. For example, for nausea and vomiting, there are a wonderful point on the arm of the patient, which is called pericardium 6. We know that pregnant women also use this point, and this point is also used for morning sickness, which helps tremendously, but especially when we use acupuncture treatment. There are special herbal remedies which will also help with nausea and vomiting. One of them being raw ginseng, raw ginger tea. If the patient has, which happens very often, the suppression of the mild production, like low white blood cells, red blood cells, thrombocytes, there are special treatments for that, which most points located on the back and next to the neck. A lot of patients will experience ulceration in the mouth. Again, we have special points in acupuncture, and I'm trying to give helpful practical suggestions. And some of them are so simple as eating watermelon or putting the slices of watermelon in the mouth. Now, radiation therapy is basically what we call is very hot in nature. Yes, we all know that radiation today is very targeted, and we're trying not to burn the areas around. But nevertheless, very often after radiation, patients will have problems on their face or in their mouth. And in this case, acupuncture and Chinese herbs are also very helpful. But of course, one of the most prevalent symptoms which we see in cancer patients would be pain, and especially headaches in the patients with brain tumors. Sometimes I have a patient who comes to me and they think that they just have a migraine headaches because all they have is pain in their head, which they think is related to migraine or nausea associated with pain. But when I do more detailed anamnesis of the patient, I have to refer the patient to the neurosurgeon to do MRI. It happened many times in my life where patient even didn't have slightest idea that they're dealing with brain tumor. Next slide, please. Patients who go through cancer treatment experience a lot of central nervous system toxicity. Many of them are having insomnia, for example. Again, acupuncture is incredibly helpful in cases with insomnia. We have wonderful Chinese herbal formulas which help with insomnia, and CBD. CBD is relatively new. When I went to medical school or when I went to Chinese medical school, all I knew about CBD or cannabis, that the seeds of that plant is helping with constipation. Today, it became a very big industry, but unfortunately, you can buy it from dispensary to any place like gasoline little shop or in boutique store. So it is not regulated system. So when you're trying to buy CBD products, make sure that the company which produces this product dealing only with organic problems, that it is third lab independent party tested. So it doesn't have heavy metals, it doesn't have any bacteria, that it is organic. And also the ratio of CBD and THC is very important. So it's very crucial to go to somebody who really understands what CBD is, what THC is. For example, for insomnia, CBN, just one isolate of that plant will be the most helpful. If you have pain, you want a special ratio of THC and CBD. So make sure that you go and consult with somebody who has knowledge of that not really new. It's 4,000 years old Chinese and Ayurvedic herb. But since it became legal on the state level and still kind of questionable on the federal level, we don't have enough research in that field in the United States. However, there are a lot of research which comes from Israel. Israel using CBD for at least 25 years, Canada using it for the last 20 years. There are a lot of wonderful work which was done on those products in Italy, in England. In the United States, we're still in the beginner stage. As we know, chemotherapy and radiation will weaken immune system. So when we do Chinese treatment, there are ways to build the immune system of the patient, to build it, because while chemotherapy will kill cancer cells or radiation, at the same time, it will kill the cells who are responsible for the immune defense response of the patient. And right now, it's especially important because we're living already second year in the time of COVID. Alopecia, most patients will lose hair if they're doing chemo or radiation. And there are wonderful Chinese herbs which also will be helpful in that treatment. Next slide, please. Some patients who will go through chemotherapy will become infertile because of radiation. So they will go into artificial menopause. So Chinese herbal medicine and Chinese acupuncture treatments will help patients not to go into menopause. Post-operative pain. Because when we do acupuncture, it is very common right now to invite acupuncturists in the intensive care unit. I'm seeing very often patients after the surgery because of release of endorphin and serotonin. It's basically natural painkillers. And we're living in the era of opioid epidemic. So a lot of patients use too many opioids, too many painkillers. Acupuncture is absolutely natural way of relieving pain. Some patients who have chemotherapy also will suffer from neuropathy. Neuropathy is the numbness in the hands and in the feet. Acupuncture, Chinese herbs, and infrared light are very helpful. I suggest a lot of my patients to buy infrared light lamps and use it no more than half an hour every day. Liver toxicity will come from heavy chemotherapy drugs. And we have special ways in Chinese medicine of detoxing our patients from side effects of those drugs. And finally, which I feel very, very important, is how Chinese medicine can help patients when they are already in palliative care. First of all, of course, control of the pain without using opiates. Another one would be the emotional support of the patient, because again, when we do acupuncture, such important neurotransmitters like serotonin and dopamine are released. So those patients who feel depressed, who have the fear of the death, who are lacking that cuddly, happy feeling, will benefit tremendously from acupuncture, from meditation, and other techniques. Next slide, please. Now, we have to be very aware that there are a lot of people who will claim that they can cure cancer with other methods. I can tell you that I never personally worked with the energy healers who claim that they can use their hands or something else to save patient from cancer. I believe that it has to be integrative approach. Next one. How do you find the right acupuncturist for your treatment? First of all, absolutely everyone in the United States who has acupuncture license should have it national and state. National is actually optional, state is required. And if you want somebody very advanced, find somebody who also has doctoral degree because it's additional 2 years of school. You want somebody who has general background in medicine, who understands not only Chinese medicine, but the whole area of what patients will deal with. It's nice to have somebody with hospital experience. And what is the most important, I think, somebody where you have patient-doctor relationship, because it's a chemistry between the doctor and the patient. And of course, experience working with oncology patients, because working with oncology patients is very different than working with other type of patients. Next slide, please. And finally, I like to end my presentation with the famous Chinese expression that in the battle of the disease, there are 3 warriors. There is a patient, there is a disease, and there is a doctor. And when I say the doctor, I mean really the whole team of the doctors. Like today, for example, we had a psychologist, a surgeon, and we had somebody from integrative medicine. It takes a village to help the patient. So when the patient and the team of the doctors are on the same side, we believe that disease will be conquered. Thank you.
Our last question is for Dr. Postolov. The question reads, how do I ensure with regards to obtaining CBD treatments that I am getting it from a reputable source? Yes, that was the question.
Well, I would think that first of all, you need to consult a person who has a license to practice it, because not everybody, actually everybody can sell it right now, but very few people do know what it is. And before I start considering myself an expert in it, I took a special educational courses. I attended a lot of seminars to educate myself. And I'm on National Educational Board for Science and Medicine in the field of cannabinoids. The product should be under good manufacturer practice code. And definitely you have to get the third-party independent report. So if you have a reputable company, they will provide you with a third-party report. What it means is that there is somebody who is not financially has any interest in that company and does that special analysis showing exactly how many milligrams of CBD, how many milligrams of THC, how many terpenes there, are they organic, is there heavy metals? So you need a very extensive third-party independent report of that product. If company cannot provide you with it, it means it's some kind of moms and pop shop who can't afford to do that lab, because that lab report is very expensive and big companies do it for every single batch. So if the company cannot provide you with the third-party report, make sure you're not buying from that company.